Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Councilmember Priscilla Tyson, President Pro Tem of City Council and Chair of these committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and Workforce Development Committees. The goal of these hearings is to promote transparency and provide an opportunity for city residents to learn and speak on legislation that impacts their lives. There will be on occasions on which a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight, we will hear information on legislation in the Health and Human Services and Finance Committees. Presenters this evening include Columbus Public Health, Nancy Bechtel, Assistant Health Commissioner and Chief Nursing Officer; Columbus Public Health, Kelly Arthur Hikes, Director of Public Health Policy; and Department of Finance and Management, Director Joe Lombardi. I will begin with legislation in the Health and Human Services Committee by asking Nancy Bechtel, Assistant Health Commissioner and Chief Nursing Officer, to present. Good evening.
Good evening. Thank you, Councilwoman Pro Tem Tyson. So our first piece of legislation tonight is ordinance number 0727-2016, which was approved by City Council on March 28, 2016, authorized the Board of Health to enter into a contract with the Ohio State University Hospital in the amount of $81,734 for outpatient ambulatory laboratory services for persons living with HIV or AIDS in Central Ohio, which include, for this particular grant, Franklin, Licking, Delaware, Morrow, Union, Madison, Pickaway, and Fairfield counties for a contract period of March 1st, 2016 through February 28, 2017. So the ordinance is needed to modify and increase the contract PO number 015109 in the amount of $80,000 for the total contract amount not to exceed $161,734 with the Ohio State University Hospital. In 2015, the Ryan White Part A program for this grant in Central Ohio served nearly 2,400 people living with HIV through several programs, including outpatient ambulatory medical care, mental health services, medical case management, early intervention services, housing services, non-medical case management, emergency financial assistance, and medical transportation.
Thank you, Nancy. I certainly appreciate that we're receiving these dollars from the federal government. Certainly knowing that we're not applying for these dollars, the dollars are coming to us because of the number of HIV and AIDS individuals in our community. So I'm happy that we have these dollars to be able to help enhance the quality of lives for individuals who have HIV and AIDS. I wish we didn't have to get these dollars, but we have to have them, and I'm glad we're able to help provide quality of life to residents in our community. And thank you.
Okay. The next ordinance is ordinance number 2855-2016. This ordinance authorizes the Director of Finance and Management to create a purchase order for Columbus Public Health for HIV/AIDS testing kits from Biopool US Incorporated, doing business as Trinity Biotech, in an amount not to exceed $28,510. Columbus Public Health provides HIV and AIDS testing for patients of our STD clinic and HIV counseling and testing site. We use these Unigold HIV test kits as a rapid HIV test for these clinics. The CDC recommends that the rapid HIV test be used to better ensure that all patients receive their results. Because Trinity Biotech is the sole provider of the only FDA-approved, CLIA-waived rapid HIV test with a 10-minute turnaround time, this purchase is being made in accordance with the sole purchase provisions of the City Code. Biopool US Incorporated, doing business as Trinity Biotech, is the sole manufacturer and distributor of these rapid HIV tests in the U.S. In 2015, we provided over 8,700 clients with these tests.
Thank you. I just want to clarify a comment I just mentioned. I just thought about it that I just said, I wish we didn't have to have these dollars. No, I'll make a clarification. I absolutely am happy that we have the dollars from the Ryan White. My comment is really that I know our numbers continue to go up, and especially in the African American community, and I certainly wish we were able to be able to do enough prevention so that we don't have to continue to have our numbers going up in Columbus. So, but since we still have individuals that have HIV and AIDS, we want to make sure that we definitely have the supportive services that we need to help them, again, have that quality of life. And in terms of legislation that you just mentioned, number 2855 of 2016, certainly I'm in support of that legislation. Thank you.
So you're right in that the HIV numbers are going up, and our African American young male population is disproportionately affected. We would always encourage people to get tested, and every chance they get tested, and to know their status. And if they don't have anywhere else to go to do that, they can always come to the health department. We'll be happy to do that testing and help them get connected to care.
And also to talk to their doctors about PrEP.
Yes, PrEP would be excellent.
Thank you.
The next ordinance is ordinance number 2801-2016. So this is also to buy testing supplies. In this case, it's chlamydia and gonorrhea testing supplies. This ordinance would authorize us to purchase chlamydia and gonorrhea test kits in an amount not to exceed $20,000. Because Hologic GenProbe is the sole provider of the DNA test kit, which is the only FDA-approved test kit available in the United States, this purchase is also being made in accordance with the sole source provisions of the City Code. So we provide chlamydia and gonorrhea testing in our STD clinic and various other clinics within the city. We like this kit because it has a higher sensitivity, specificity, and transportability than other types of testing methods. Last year, we provided nearly 2,000, and this year with these dollars, we would be able to do about the same with this amount of money.
Thank you.
The next ordinance is number 3129-2016. We've been awarded a grant from the Ohio Department of Health, and this ordinance is needed to accept and appropriate this grant in the amount of $194,276 to fund our Neisseria meningitis grant program for the period of January 1st, 2017 through July 31st, 2017. Funding to provide resources for Neisseria meningitis, urogenital disease, will enhance our surveillance and laboratory capability, which will lead to a better understanding of the burden of this disease, sexual transmission routes, and risk factors for the population.
Thank you.
Next piece of legislation is ordinance number 3064-2016, and this is to authorize a contract with Community Development for All People. Columbus Public Health has a need to provide neighborhood-level intervention work to address the social determinant of health in the near South Side community as a part of our infant mortality initiative Celebrate One goals to reduce infant mortality. This ordinance authorizes the Board of Health to enter into a contract with Community Development for All People, a nonprofit community agency located in the Near South community, in the amount of $125,000 for the period of December 15, 2016 through December 14, 2017. RFQ 002367 was bid on the city's vendor services website. An evaluation of all bids received was performed, and it was determined that Community Development for All People was the most responsive, knowledgeable, and best bidder.
And certainly you have a number of other pieces of legislation that are also focusing on the work in terms of neighborhood level intervention to address the social determinants of health in terms of most of the communities. And can you just talk about generally what type of programs and services are being offered from these organizations?
So this organization is to help us look at our infant mortality work, so to address factors that relate to infant mortality. You know that our infant mortality initiative there's a disproportionate number of African American babies that die before their first birthdays, and the African American population is disproportionately affected by preterm birth and low birth weight babies. So community development for all people will help us work with population on the south side that is disproportionately affected to address circumstances related to infant mortality.
And I know you have to go to another event this evening which I'm glad that you're going to that event, dealing with addiction. What will be important is to be able to find out that a lot of the underlying factors are also affecting infant mortality. And you don't have to share it right now. We can talk about it later. But that's what this is about also, correct?
Yes, so it is uncovering some of those underlying factors and us helping to do interventions around those.
Thank you.
Some of that has specifically to do with like birth spacing, smoking, those kinds of underlying factors that the population may or may not realize is affecting the outcome of their births and their infants living to a year of age.
Thank you.
The next ordinance is ordinance number 3076-2016, and this is to authorize a contract modification with Access Health Columbus, which is doing business as the Healthcare Collaborative of Greater Columbus. This ordinance is an add-on to another one as well. So ordinance number 0353-2016, which was approved by City Council on February 22nd, 2016, authorized the Board of Health to enter into a contract with Access Health Columbus, doing business as the Healthcare Collaborative of Greater Columbus, in the amount of $190,000 to fund Celebrate One initiatives as recommended by the Greater Columbus Infant Mortality Task Force for the contract period of February 23rd, 2016 through February 22nd, 2017. This ordinance is needed to increase and extend contract PO 002289 in the amount of $135,000 for the total contract amount not to exceed $325,000 for a time period ending December 14, 2017 with the Healthcare Collaborative of Greater Columbus. This modification is needed to provide neighborhood-level intervention work to address social determinants of health in the Near East community as a part of the Celebrate One goals to reduce infant mortality. And it's looking at some of the same kind of interventions that we'll be doing on the south side as in the Near East. The next ordinance is number 3080-2016, and this is to do a contract modification with St. Stephen's Community House. So ordinance number 2945-2015, which was approved by City Council on December 7th, 2015, authorized the Board of Health to enter into a contract with St. Stephen's Community House in the amount of $40,000 to lead the Celebrate One neighborhood-level intervention work that addresses social determinants of health and infant mortality in the Linden community for the period of December 1st, 2015 through June 30th, 2016. This ordinance is needed to increase and extend contract EL 017776 in the amount of $100,000 for the total contract amount not to exceed $140,000 for a time period ending June 30th, 2017 with St. Stephen's Community House. This modification is needed to continue the work in the Linden community. The next ordinance.
We want to make sure we check the legislation, because I know it says here that it was approved by council on December 7th of 2017.
That's why
we're going to make sure that we have to amend the legislation, because I know hopefully it was December 7th of 2015.
Yeah, it has to be a typo.
Yes, thank you.
The next ordinance is number 2958-2016, and this is to modify contracts with Community Development for All People, Somali Can, and the Moms to Be. So ordinance number 0860-2016, approved by City Council on May 2nd, 2016, authorized the Board of Health to enter into a contract with Community Development for All People in the amount of $45,199.54, and a contract with Somali Can in the amount of $44,752.02, allowing for not-for-profit community agencies to meet the deliverables through the United Health Foundation Celebrate One Community Connector Cork project. In addition, we entered into a contract with Moms to Be in the amount of $14,917 to provide the same services within their neighborhood. This project helps support a citywide resident engagement program to connect pregnant women to medical and social supports in their neighborhoods. The initial contract period was February 1st, 2016 through January 31st, 2017. This ordinance is needed to authorize a modification to extend the contract period through October 31st, 2017, and to increase the contracts as follows. So for Community Development for All People, the contract number is PO 009958. It's to increase the amount by $5,000, not to exceed $50,000, $199.54. For Somali Can, contract number PO 009920, the increased amount is $17,305.56 for not to exceed $62,057.58. And for the Moms to Be contract number PO 012877, the increased amount is $34,611.12, not to exceed $49,528.12. So the total increased amount for all three contracts is $56,916.68, not to exceed $161,785.24.
Thank you. And we're coming up to a year for having our community health workers. Is that correct?
Yes, we are.
And we're very excited about that.
Yes. And this project will serve approximately 4,000 women annually.
All right, and it was help to identify and engage women and families to schedule prenatal and primary care appointments, refer women to services that address their basic needs and needs for new infants, cribs, food, housing, and security, et cetera. Follow up with families to make sure they're connected to services that are a barrier or access issues experienced by the families, and inform partners about gaps in services and validate pathways for residents that lead to positive birth outcomes in our neighborhoods. So this is a great program to help ensuring that our babies do live, not to live to their first birthday, but also to help their families and even have a greater quality of life. So this is great legislation. Thank you.
Thank you. Next piece of legislation is ordinance number 2695-2016, and this is to authorize our Board of Health to accept and appropriate our Healthy Start grant funds. So Columbus Public Health has been awarded a grant from the U.S. Department of Health and Human Services. This ordinance is needed to accept and appropriate a grant of $1,080,000 to fund our Healthy Start program for the period of November 1st, 2016 through October 31st, 2017. The Healthy Start grant program enables Columbus Public Health to conduct a home visiting care coordination program in Franklin County, focusing primarily on perinatal and infant clients and their families. Healthy Start is funded to serve 800 clients, of which 400 are pregnant and 400 are parenting women and their infants up to the age of 2 years old who reside in Franklin County. Clients receive education on pregnancy, women's health, infant growth, development, safety, nutrition, immunizations, breastfeeding, and safe sleep.
Thank you.
The next ordinance is 2914-2016 to authorize the Board of Health to enter into various contracts for this Healthy Start grant. So there's several on here. I'll go through them one at a time. So the Board of Health has been awarded a grant from the U.S. Department of Health and Human Services for the Healthy Start grant program. We've been designated as the primary grantee agency and administrator for the Healthy Start grant program in Franklin County. The grant funds awarded provide for multiple contracts to meet various grant deliverables in an amount not to exceed $353,750 among the contracts. So the contracts named in the approved grant application are Mount Carmel, number 31-1113966 for $130,000. Decision Support Services Incorporated, number 31-1414027 in the amount of $41,750. Ohio Health, number 31-4394942 in the amount of $130,000. Moms to Be, number 31-602-5986, in the amount of $15,000. Challenger Soft, number 72-108-9509, in the amount of $22,500. Mental Health of America, number 31-441-2697, in the amount of $7,500. And Action for Children, number 31-082-0393, in the amount of $7,000. Do you want me to read what each agency will do under this term?
You can if you like.
Mount Carmel will enroll 200 pregnant clients. Ohio Health will enroll 200 pregnant clients. Moms to Be will provide education to our enrolled pregnant and parenting clients. Action for Children will do father engagement, providing support and education to dads of enrolled clients. Mental Health America will provide enrolled clients with support and linkages for mental health issues and maternal depression. Decision Support Services, they are our external evaluator for the grant, and they're responsible for compiling and analyzing program implementation and our performance using appropriate quantitative and qualitative methods. Challenger Soft is our data system for the project, and will provide our data system so that we can do our reporting and maintenance.
Thank you, and certainly appreciate these organizations who are going to be getting funding to support the women and families in our community. How can a nonprofit organization get dollars to also support their, for example, the pregnanting teens, like the organization, the Center for Healthy Families, who all they do is focus on teenage girls that are pregnant?
I would say so the grant is pretty prescriptive in the services that we provide. If there's an agency that thinks they might want to partner with us in some work, they can contact us at the health department. They can contact me, 614-645-0803, and I can direct them to the right person, probably our division director or this particular grants manager.
Thank you.
We usually allocate the dollars, it's a 5-year grant, and we're usually, thinking ahead about a year how we're going to partner with folks. So if there's interest, obviously we need folks to contact us. Okay. The next ordinance is number 2992-2016. So this is to, again, do a series of contracts. Columbus Public Health desires to continue the Family Ties Program partnership with a revenue contract with Franklin County Children's Services. The purpose of this continued revenue contract is to provide services that will reduce the risk of child abuse and neglect in Franklin County. The services that we will be providing to FCCS clients under this ordinance include case management, public health nurses, social workers, and respite workers. In addition to the revenue contract with FCCS, Columbus Public Health is required by FCCS to contract with the National Youth Advocate Program Incorporated and the Buckeye Ranch Incorporated, doing business as Permanent Family Solutions Network, to provide family ties services. Both vendors provide assistance to FCCS with their caseload. The revenue contract for the Permanent Family Solutions Network will not exceed $35,000, and the revenue contract with National Youth Advocate Program Incorporated will not exceed $10,000. CPH will bill both vendors for services provided under the revenue contract. These 3 agencies provide the referrals to Columbus Public Health and the funding for the Family Ties program for a total award amount not to exceed $320,000. This ordinance authorizes the Board of Health to continue revenue contracts with FCCS, the National Youth Advocate Program, and Permanent Family Solutions Network for a period of January 1st, 2017 through December 31st, 2017, and to authorize the appropriation of $320,000.
Thank you.
The next ordinance is number 3049-2016, and this is also to authorize a revenue contract with FCCS. So Columbus Public Health has maintained the revenue contract with Franklin County Children's Services for the provision of nursing services to children under their care by assigning public health nurses to the FCCS Intake and Investigation Department. These public health nurses will perform health assessments of children, make home visits with intake staff, provide nursing consultation and training, interpret medical reports, and help development treatment plans for families referred to FCCS. The Board of Health desires to continue this relationship with FCCS by assisting their efforts in assessing children at risk. This ordinance authorizes the Board of Health to continue in this revenue contract with FCCS for the period of January 1st, 2017 through December 31st, 2017, and to authorize the appropriation of $325,000.
Thank you.
The next ordinance is number 2963-2016, and so this is to accept and appropriate 2017 grant, our Creating Healthy Communities program grant. So Columbus Public Health has been awarded a grant from the Ohio Department of Health originating from the Centers for Disease Control. This ordinance is needed to accept and appropriate $125,000 in grant monies to fund the 2017 Creating Healthy Communities grant program for the period of January 1st, 2017 through December 31st, 2017. This grant will utilize population-based strategies to address healthy eating, active living, and smoke-free living with the goal of reducing chronic diseases. The program focuses on the residents of Linden, the South Side, Franklinton, and the Hilltop.
Thank you, Nancy.
Okay. The next ordinance is number 2911-2016, and this is to authorize a contract with Comp Drug and their incorporated youth-to-youth program. Columbus Public Health was awarded $110,000 in grant monies via ordinance 2903-2016, excuse me, from the Ohio Department of Health, originating from the Centers for Disease Control for the Tobacco Use Prevention and Cessation Grant Program. This ordinance is contingent on the passage of ordinance number 2903-2016 and is needed to authorize a contract with Comp Drug Incorporated, their youth-to-youth program, for $60,000 for the time period December 1st, 2016 through June 30th, 2017. The purpose of this contract is to fulfill deliverables for the youth objectives related to tobacco prevention and cessation. Excuse me. This contract is necessary per the requirements of the Ohio Department of Health Tobacco Prevention and Cessation Proposal. Former bids were not solicited due to the knowledge and expertise of this nonprofit community organization and in accordance with the provisions found in City Code 329-3.0.
I think it's important to stay on this legislation that tobacco use is a contributing factor in 4 out of the 5 leading causes of death in Linden, South Side, and the West Side neighborhoods. More specifically, cancer is a leading cause of death in Linden and the West Side priority communities, while heart disease is the leading cause of death in the South Side. And so this legislation is extremely important so that we can try to prevent our young people from beginning to smoke and to provide the services for those who are in those communities so that they can begin to get the help that they need for the addiction of smoking. Thank you.
The next legislation, I'm almost done, is number 3098-2016, and this is to authorize a contract with Measurement Resources Company, LLC. So Columbus Public Health has a need for consultation services to assess and recommend primary care services for Columbus residents. This ordinance authorizes the Board of Health to enter into a contract with Measurement Resources Company, LLC, in an amount of $98,485 for the period of December 15, 2016 through December 14, 2017. RFQ 003306 was bid on the city's vendor website services. An evaluation of all bids was received, and it was determined that Measurement Resources Company, LLC, was the most responsive, knowledgeable, and responsible bidder.
Thank you. I look forward to the results of this assessment. And certainly in light of listening to now some of the changes that, from looking at the Affordable Care Act to now, hearing discussions about the change in the Affordable Care Act moving forward and how that's going to affect our community in terms of providing quality health care. So this will be very important. Thank you.
Okay. Next, and second to last, ordinance number 2814-2016, and this is for us to be able to enter into contract with Continental Office Furniture. The purpose of this legislation is to authorize the Director of Finance and Management to establish a purchase order for the installation and purchase of modular furniture for Columbus Public Health, utilizing funds from the Health Department Grants Fund. So Columbus Public Health is in a need for additional modular furniture and reorganization of office space for efficiency for our Healthy Start grant program. Obtaining Herman Miller brand furniture will ensure the compatibility of new units with the existing modular furniture and ensure that the warranty of their original furniture is maintained. Continental Office Furniture is the sole exclusive provider of Herman Miller for the Columbus and Franklin County markets. Okay, last, ordinance 3045-2016. This is to accept and appropriate grant monies from the Ohio Environmental Health Protection Agency. Columbus Public Health's Environmental Health Division has been awarded a grant from the Ohio Environmental Protection Agency. This ordinance is needed to accept and appropriate $42,600 in grant money to fund the Mosquito Control Grant Program for the period November 15, 2016 through September 31st, 2017. The Mosquito Control Grant Program will expand the current mosquito control efforts to include control measures related to the Aedes albopictus mosquito, which is an established mosquito in central Ohio. So these monies will allow us to augment our typical vector control program. Through an integrated pest management, we will be able to provide outreach to Columbus residents, larviciding to reduce mosquito population, breeding in standing water, trapping and testing for the West Nile virus, and fogging with pesticides in areas that test positive for West Nile virus. Finally, these monies will allow us to have a meaningful response to Zika travel-related infection cases in order to educate, trap for mosquitoes, and treat areas within 150 feet of that home.
Thank you, Nancy, and certainly to appreciate throughout the legislation that you have proposed tonight that we have received significant dollars from the federal government, obviously from the state of Ohio. Sometimes that's via the federal government, but certainly do appreciate receiving these dollars to help provide the services that are needed for our community. And again, this last one augments the work that we're currently doing in terms of our own vector control program, and just appreciate getting those additional dollars. So thank you for presenting this evening. I know you have to go to another meeting, and I thank you for being here.
Thank you.
And so now, I'm going to move to Kelly Arthur Hikes, Director of Public Health Policy from Columbus Public Health. She's here to cover legislation which I have been developing with the support of several key stakeholders. In this legislation will prohibit tobacco sales to anyone under the age of 21 and require vendors to obtain a tobacco license, which will be administered by Columbus Public Health. This is a public health issue, and I'm championing this, and now I turn the floor over to Kelly Arthur Hikes.
Thank you, Council President Pro Tem Tyson. Tobacco 21, as it's most commonly known, or Ordinance 3156-2016, will amend City Code to prohibit tobacco sales inclusive of all products and paraphernalia to anyone under the age of 21 within the City of Columbus. It will require tobacco retailers to obtain and retain a retail tobacco sales license administered by Columbus Public Health. It will require vendors to display approved signage stating the prohibition of sales to those under the age of 21 and require ID for sales to those under the age of 30. It will also prohibit the sale of tobacco and paraphernalia through vending machines and create the authority for CPH to develop and administer a civil process designed to increase compliance and enforce the terms of the retail tobacco sales license. I think it's important to note that City Code will retain police enforcement authority for the criminal offenses related to tobacco sales. So they will be able to do exactly what they are doing now by raising the age from 18 to 21. And those offenses are against the individual sales clerk, whereas the civil process will be against the retail tobacco sales license holder or the owner-operator of the business. If council adopts this ordinance and it's signed into law, then the Board of Health will have the authority to amend our health code to be able to require the tobacco sales license. We're looking at September 30th annually and making late fees apply. Sanitarians would do compliance checks for signage and basic vendor education on tobacco sales. We would contract with a community-based organization for underage buy attempts, kind of a secret shopper program, if you will, and reports will be shared with our Board of Health to initiate a license review as needed. We will initiate a license review upon reports of underage sales. This process will include meetings with the vendor, sanitarian-supervised underage buy attempts, civil fines, and if warranted, revocation or non-renewal of a retail tobacco sales license. Selling without a retail tobacco sales license would be a criminal offense, and that authority would fall under police to enforce. CPH is excited that we would be responsible for the education, community, and vendor awareness, and all of the signage for vendors at the point of sale. We will share reports of civil violations with police and the city attorney's office. Police will share reports of underage tobacco sales with CPH so that we can consolidate our efforts and make sure that we're not, or that we're finding people that are perpetually selling to underage consumers. And CPH will conduct internal assessment or evaluation every 6 months for status of compliance and enforcement processes and resources. We're a data-driven organization, and we want to make sure that what we're doing is effective and efficient. We are extremely excited about this opportunity that this law would create to reduce youth smoking and tobacco use, and we're excited about the opportunity to reduce the negative health and economic impacts that this addiction creates in our community.
Thank you, Kelly, and certainly want to recognize you and Andrew Dwyer, who is in council chambers, for the work that you have been doing, working with me and the stakeholders. So just truly appreciate that. We have 2 speakers on for this ordinance. I'm going to ask them to, I know we normally have speakers at the end, but since it's specifically on this ordinance, I'm going to ask them to come up now. So the first speaker is Rebecca Grant. Good evening. Yeah, just walk to the podium and certainly state your name and who you represent.
Good evening. My name is Dr. Rebecca Grant, and I'm here to support the passage of Tobacco 21. I'm a family physician practicing at both the Ohio State Wexner Medical Center, CarePoint East practice, as well as Nationwide Children's Hospital Teen Clinic, where I serve as the clinical lead for that program. Every week, I have the privilege of caring for dozens of teenagers. The majority of the patients that we serve are between the ages of 12 to 21. At the start of each visit, we screen our patients for the use of drug use and tobacco use. Our patients are really open and candid with their answers to this question: do you smoke or chew tobacco? Here are some of the common responses we receive. Yeah, I don't smoke cigarettes though. I smoke blacks, referring to black and mild cigars. I smoke cigarettes, but only when I'm with my friends. I don't smoke, but I vape sometimes, referring to inhaled vapor from electronic cigarettes. Or they just may give an indication of yes, followed by a couple of FTs or Newports, referring to filtered tip cigarettes, which are black and mild cigars also, and Newports contain menthol. In my experience, teens start smoking because they're offered by their friends to try a cigarette or a cigar. They become more frequent smokers as they get older and they're not under their parents' supervision, and so it's easier for them to purchase these tobacco products. Teen smoking is a very real and relevant issue here in the city of Columbus. Although African Americans' youth tend to not start smoking until their later teen years, they are often more likely to become profoundly addicted and have an increased risk of dying prematurely due to smoking. As a family doctor, I care for patients of all ages, from infants to elderly. Almost daily, I see firsthand the damaging effects of tobacco addiction on our Old Town East community. I have seen patients suffer from harmful effects of smoking, such as amputated limbs, repeated strokes, heart attacks, and complications of low birth weight infants born to tobacco-addicted mothers. Our best strategy to combat tobacco addiction in our Columbus communities is to prevent it from starting at all. That's why Tobacco 21 is so important and so relevant. We have a great opportunity to reduce preventable deaths among the most vulnerable population. By increasing the legal tobacco sales age to 21, it will make it more difficult for our teenagers to acquire tobacco products, ultimately reducing their chances of becoming addicted. Some of my colleagues despise working with teenagers. I love it. I feel like the adolescent years are the most impressionable and you can have the most impact on these patients. I feel I can help reframe these patients' thinking about how to make good choices as they grow into their adulthood. I relate to them differently than other providers because when I look at them, I see me. I've been in their shoes, plagued by daily peer pressures and sometimes unsure about which path to follow. I feel obligated to stand in the gap for them while they are still learning how to make good choices. Supporting Tobacco 21 is one tangible way for me to protect the lives and health of our Columbus youth. Will you join me in supporting this great legislation? Thank you.
Thank you, Dr. Grant, for coming down and testifying. And certainly the neighborhood that you just mentioned, Old Town East, from 43205, 43206, and the individuals that are in that community, and just appreciate the work that you're doing and that you have a love for working with our teenagers. And as you said, some of your colleagues may not, but you love standing in the gap, and we truly appreciate that, and helping them to make really good choices. We need individuals to help to guide them. Sometimes they don't want to listen to their parents, but they'll listen to someone else. So thank you for coming down and testifying today and sharing why Tobacco 21 is so important to our community. Thank you so much. Our next speaker is Benjamin Coop, I'm sorry. And again, just state your name and who you represent. Thank you.
Thank you for allowing me to speak. I'm Dr. Benjamin Kopp. I'm a pediatric pulmonologist and scientist just up the road at Nationwide Children's. And I want to tag along with what Dr. Grant was saying. That's a tough act to follow, but and kind of give a little bit of the other side of the severe burden of tobacco-related diseases that we're seeing in children these days, is particularly from secondhand smoke exposure. So I deal every day with children with severe breathing disorders, and we also do research into the mechanisms by which these diseases persist in children. And so I can tell you that the number1 admission to Children's Hospital is for breathing-related disorders. And there's a disproportionate amount of children with smoke exposure that are admitted to the hospital. So I've been the inpatient attending in charge of the hospital service for the past 2 weeks. And each day, from 40 to 50% of these children that are hospitalized with severe asthma and other breathing disorders have parents that are smoking. And the alarming part about this, besides just the high volume, is this is really an underreported number, probably, because we know from our objective studies when we do measurements of nicotine, the byproduct of cigarettes, or even from those that vape electronic cigarettes, these numbers are often double what the parents actually report. And so we have this large number of children that are hospitalized that are exposed to tobacco smoke, and they continue to be hospitalized. And the other trend that we're seeing over time is that there's a lot of young families that are smoking these days. So the children in the hospital, whether they are a premature baby that has predisposition now to lung disease because they were born prematurely to smoking parents, versus just children that have disease that's refractory to treatment because their parents continue to smoke. So you can go from patient to patient in the hospital, and the parents don't have a treatment plan for how they're going to get off this addiction to nicotine, despite the resources that we give them. And then we see the same families come back. And these are children right around these neighborhoods in Columbus. There's a large proportion of our asthma comes from this population. And then if we take some of our other lung diseases that we see, I work a lot with our sickle cell disease population. And these are children that do not inherently have lung disease but develop it over time. And the majority of those that we're finding from, again, our objective studies where we measure nicotine levels in these children, those that have lung disease and have recurrent hospitalizations have families that are smoking. And these teens are also starting to vape because they don't realize that there's nicotine in that, and that is harmful to their lung system. And from the science side, we know that nicotine in itself is harmful to the respiratory system. So whether it's from a combustible product like a traditional cigarette versus the new electronic cigarettes, the nicotine that's present is directly harmful to our airways. So we can look at this in the laboratory and see toxicity to cells just from these products that are out there, as well as what we see every day in the clinics. So I'm really in support of this legislation because we need new ways to protect our children from ongoing smoke exposure, and the current legislation is not protecting and not stopping that next generation of smokers.
So we had a hearing last week, and certainly a number of individuals testified, mostly all in support, but there were a few that were not in support. Mm-hmm. And they were not in support because they thought that vaping was a way to get individuals off of cigarettes, and that that was a better way to get people off of cigarettes, and so that's why they felt as though vaping should not be a part of this legislation. Could you address that for me?
Sure. So I think the literature regarding electronic cigarettes as a cessation tool is very mixed, and as we have continued studies over long-term effects of this, it's not shown to be a tremendously successful agent, although there are certain people, I will admit, adults that it works for, but that's not the population we're really targeting. We're targeting teenagers and young adults from continuing smoking or being exposed to smoking products that they will become addicted to. So those children are not the ones that need to be able to have access to vaping and electronic cigarettes. And really, if we catch them early and prevent them from smoking, we aren't in need of a cessation tool for them. But I think the availability of vaping for adults over 21 is a separate issue than what we're dealing with here. So.
Thank you, and certainly appreciate the work that you are also doing to support our families and children, and thank you for coming down and testifying again around secondhand smoke. Also, the role that smoking plays in terms of asthma within when young people have asthma and their parents are continuing to smoke. And I think you testify that even then, when you share with them about secondhand smoke, the parents, because they have an addiction, and you're providing them with information, they're still smoking. And so I thank you for coming down and sharing your testimony. So with that, I think that we had 2 speaker slips, and thank you for coming down and testifying. And now we will hear from our esteemed Finance Director, Director Joe Lombardi, will now review his legislation for the next 2 weeks. Good evening.
Good evening, President Pro Tem Tyson. We typically do these in numerical order, and I would ask if there was a way that I could skip to one. We have a speaker here this evening from Capital South, and if we could skip to that one, it's 3063, if that would be okay with you.
Absolutely. You've been so kind to let other departments go ahead of you, so I would be happy to, let's see. 63, correct?
Yes.
The
Yeah.
development firm.
Yes.
Yes, absolutely.
Thank you very much. So as I read the title, I would ask that Matt Lutz from the Columbus Downtown Development Corporation come up to the podium, and he will speak about the project. This ordinance authorizes the Finance and Management Director to execute a quick claim deed to Capital South, conveying title to the property to be split from 3rd Street lot to execute joinders and consents to utility encroachment maintenance temporary construction easements necessary for redevelopment and to execute other pertinent documents. And this also requests the waiver of the requirements of 329 of the Columbus City Code. I will discuss the reason why we're waiving the code and then ask Mr. Lutz to please talk about the development project. The reason why we're waiving the requirements of 329 is in 329, in a certain section of that code, authorizes the Director of Finance and Management to sell any city property that is considered surplus. And in our discussions with the city attorney and to Ann Kelly in my real estate office, we've all agreed that it was in the best interest to go ahead and convey this property to Capital South for this redevelopment project. So that's why we're waiving that portion of the code.
All right, go ahead, please, make your presentation. Again, state your name and who you represent.
Thank you. I am Matt Lutz. I'm the General Counsel and Chief Development Officer with Capital South. And I'm happy to come to you today with the final phase of the Columbus Commons. Capital South and the city embarked together on this effort in 2009 when we had a dead mall on our hands. Took a lot of hard decisions, and we've had a tremendous success. The first phase was, of course, building out the park itself after we tore down the mall. The second phase was building out High Point and 250 High, which are now fully leased and very successful projects. And we're now seeking your approval for the last phase of the Commons, which is the mixed-use office building that will go in the southeast corner of the Commons. If you recall, it's the corner where the Marshall Fields used to be. This project is with the same developers that did 250 High. It's with a partnership between Daimler and Kaufman. That's been a very successful partnership for us in putting together the mixed-use office and residential building at 250 High that we feel is a paradigm of good downtown development. The new project is programmed to have 170,000 square feet of office space and first floor retail space, 120 units of rental residential, and it will be 12 stories tall. And so with your approval, we're proposing to sell them 0.88 acres, which is the footprint that they need for the actual building, for a purchase price of $2.4 million.
Director, you have other comments on this legislation? I have a couple questions.
Sure.
Okay. So, so we're selling it for 2.4, and between Ann Kelly from your team and not Capital South, but the Columbus Downtown Corporation, we felt that was, do we do an appraisal? Do we figure, how do we come up with the price of 2.4 million?
I believe, and I can ask Mr. Lutz if he would have more information on that, but in talking with Ann Kelly, I believe she believes this is a fair value. We'll get a portion of that as part of the agreement. I don't have that answer for you this evening, but I can certainly get back to your office and let you know what portion of that we'll retain for the city of Columbus.
Thank you. That will be helpful. Just wanted to, right, I do. The next question was going to be, what portion are we going to receive for the city of Columbus? But you'll get back with me on that.
We sure will.
Okay. Well, I'm excited that we are finishing Columbus Commons. Certainly, I just have to say that the team has done just a tremendous job. When I think about what that space was when we shut down City Center and when we decided that it was going to be this green space, and we were going to, of course, build the stage and then, have the green space, and then we're going to start building buildings on it. I mean, just what the plan was initially stated, this was years ago, obviously, that everything that was part of that plan has certainly coming to fruition, and it's just great, and with the Commons. So just really do appreciate certainly all the work that's been done by the team, working on the Columbus Commons and just the whole downtown development, and just appreciate the work that you've been doing, and looking forward to get the question answered, but again, just very excited at what's the fruit of the labor for downtown. So, thank you. Thank you.
Our next ordinance is 2399, 2016. This is to authorize the Director of Finance and Management to modify an existing contract with KNS Services, Inc. for services and maintenance for security systems, to authorize the expenditure of $20,000 from the general fund, and to waive the competitive bidding requirements of Columbus City Code 329. KNS Services provides all the hardware, software, and technical support for many of our security systems around the city of Columbus, including at City Hall, the Columbus Health Department, Arlington Gate, and others. The additional $20,000 will be used to add some cameras over in the 77 North Front, also to do some maintenance on cameras at our Short Street facility, the mayor's reception area, and also our police firing range. The reason for the waiver of the competitive bidding is that KNS Services, again, provides all the technical support, the hardware, and the programming of that system, and so we are waiving the competitive bid to enter into contract with them.
Thank you.
Next ordinance is 2820, 2016, to authorize the Finance and Management Director to enter into one universal term contract for the option to purchase car seats with Evenflow Company, Inc., and to authorize the expenditure of $1 to establish that contract. This contract will allow the Public Health Department to provide car seats to assist underprivileged families, the ability to have car seats to safely transport their children through the car seat program at the health department.
We're so excited to be able to have that program for our families. I know that Councilman Cinziano put some additional dollars into that program this year, and if we're adding more dollars, there must be an increase in demand. I know for those car seats. So we want to be able to make sure that people can take their kids home from the hospital safely, and just to continue to make sure that our kids are able to have their quality of life by riding in one of these car seats. So thank you.
Welcome. Our next ordinance this evening is 2893, 2016. This is to authorize the Finance and Management Director to modify a contract on behalf of the Office of Construction Management with Shore Architects, Inc., and to authorize the city auditor to establish an auditor certificate and process expenditure corrections and funding transfers in accordance with changed funding sources, and to authorize the expenditure of $12,148.64 from the Construction Management Capital Improvement Fund. Essentially, what happened here is that we established multiple purchase orders for the Department of Finance, Public Safety, Public Service, and Technology to provide professional architectural engineering services. As a routine internal review, we had caught that some expenditures were taken out of the wrong funds. So this ordinance allows us to make expenditure corrections back to those funds and authorize that for Mr. Dorian to move that money back to make everybody whole again. So in other words, we may have paid for a service that was done for technology and accidentally paid it out of the public safety money. So this ordinance is going to move money back to where it belonged. And that was during an audit that we did internally to ensure that there were no other mistakes made.
And so with the mistakes that were made, but you still need additional dollars to be
These won't be additional dollars. This is just to true everybody up. Yeah, there's no additional dollars. It's just truing all the funds up.
Oh, okay, so
yeah.
it's moving the dollars around.
Yeah, it's just moving them around. Mhm.
Okay. And you needed our approval to be able to shift those dollars around?
Yes, ma'am.
Yes. All right, thank you.
The next ordinance this evening is 2936, 2016, and this is to authorize the Finance and Management Director to renew a contract on behalf of Facilities Management with Windscapes for mowing, landscape maintenance, and snow removal services for locations under the purview of the Facilities Management Division, and to authorize the expenditure of $310,000 from the general fund. This ordinance seeks authority to enter into a third of 4-year possible renewals. This is the third year. This company will provide, unfortunately, snow removal services for us in the wintertime. They also do landscape around City Hall and other buildings. So this is just a renewal as part of the original contract.
And Director, can you state how you determine when our facilities management are going to provide those services versus when we're going to have a contract services?
Yeah, sorry about that. So typically what we do is if it's beyond the capabilities of our staff or if it's more than our staff can handle, then we will contract with Windscapes to help us. It's basically as we need them, we will call them.
Thank you.
The next ordinance is 2969, 2016. And this is to authorize the Finance and Management Director to enter into 3 universal term contracts for the option to purchase services to inspect and repair fire and smoke dampers at various city locations with Julian Spear Company, Simplex Grinnell LLP, and Columbus Heating and Ventilating, to authorize the expenditure of $3 to establish those contracts and to waive the competitive bidding provisions of 329. The reason why we are waiving the competitive bidding is we are awarding all 3 of these companies a similar line item, and we felt it was in the best interest of the city at this time to do that. I know we've been working diligently to try to get that changed, and we haven't done as many as we did at the early part of the year. And the reason being, we have about 25 buildings that have about 250 to 300 fire dampers, and one company probably will not be able to handle all the inspection and service. And the way we're going to work this is that we will solicit bids from all 3 of those companies when we have a group of buildings that we need inspection for, and someone will get that contract and then recommend back to us what needs to be done. Then we'll go back out again to those same 3 companies and ask them to bid on the repair or the maintenance of that, and it could be a different company that would get that. So it's, and it could be a company may get 2 buildings and some companies may get 3 buildings and 1 building. So we're going to probably share the opportunity between the 3 companies.
Okay, thank you. And so the estimated spend will be $50,000?
Yes, ma'am.
Okay, thank you.
The next ordinance this evening is 2986, 2016, and this is to authorize the Finance Management Director to establish various purchase orders with Keen's Body Shop, MI Collision, and Custom Fleet for body shop services for Fleet Management Division per the terms and conditions of already established universal term contracts, and to authorize the expenditure of $30,000 from the Fleet Management Operating Fund. We are just establishing funding for 3 body shops for our typical body shop repair for our vehicles. Ordinance number 1719, 2016 was established in the amount of $2.4 million early this year for various services, including parts and supplies. And we'll just need another $30,000 to get us through the first quarter of next year. And hopefully we won't have too many cars that we'll need to have body repair on.
Thank you.
The next ordinance is ordinance 3006, 2016, and this is to authorize the Finance Management Director to enter into a contract on behalf of the Office of Construction Management with General Temperature Control for roof safety improvement renovations at 4260 Morse Road, and to authorize the expenditure of $222,000 from the Construction Management Capital Improvement Fund. This contract will allow us to to include some new roof accesses and pre-engineered walkways. The low bid, apparent low bid was JB Roofing. However, when you account for the environmental credit that is available in the City Code 32917, you apply a 5% credit. In general temperature control was applied that 5% credit and made their bid lower when you applied that 5% environmental credit. And they're also going to use environmentally friendly products as part of this contract. So we feel that it is a good contract, and we think it's going to be a good environmental project on top of it.
Just talk to me a little bit about when mentioning the roof safety improvements. And we're doing these at Morris Road, but is this something that we're going to be doing at other buildings that we have, or is just more just particular to just one building? Can you share that with me, please?
Sure. As we look at all of our buildings, we want to make sure that they all have fall protection from our roofs, and if they do not have our current buildings, we will go back and try to do that. But I believe this particular one is for this building. But as we build buildings, these sort of things are already incorporated as part of the specifications as we build new or if we renovate.
And so, but you don't see right now only new buildings, or you're saying if you renovate a building, then you would go and do this?
That is
make
correct.
These improvements?
That is
Okay.
correct.
Okay, we want to certainly make sure that, that all of our buildings are in an environment where all of our employees certainly are going to be, if they're going to be on our roofs and fixing any repairs there, that we want to make sure that all of our staff have the necessary safety measures in place. So I thank you for your department's foresight in really executing this project. So thank you.
You're welcome. Our next ordinance is Ordinance 3015-2016, and this is to authorize the Finance and Management Director to enter into one universal term contract for the option to purchase golf course supplies from Century Equipment, Inc., and to authorize the expenditure of $1 from the general fund to establish that contract. These items will be used at our city's 6 public golf courses, and the supplies for those golf courses. The funding will come from Rec and Parks, and the annual expenditure is about $10,000 for recreation and parks.
Thank you.
The next ordinance this evening is 3020-2016, and this is to authorize the Finance and Management Director to enter into one universal term contract for the option to purchase dental supplies with Henry Schein, Inc., to authorize the expenditure of $1 to establish the contract from the general fund. This contract will allow the Columbus Public Health Department at the dental clinics and the dental sealant team to go out to schools to provide sealants to students who have parental approval to do so. So this is a great contract for our public health department group to be able to go out to the children and be able to give them sealants so long as they have parental approval.
Thank you. I know that maybe a few weeks ago we passed the legislation through Columbus Public Health to be able to have the contract to go into a number of go into Columbus Public Schools, but some other schools through it in other counties, and just really do appreciate Columbus Public Health taking on this role and making sure that, especially the elementary school, and I think maybe the early grade of middle school, that they don't have, helping prevent children from having those cavities. So thank you.
You're welcome. The next ordinance is Ordinance 3078-2016, to authorize the Finance and Management Director to enter into a contract with Enforcement Video, LLC, doing business as WatchGuard Video for the Division of Police for the option to purchase body-worn cameras and associated accessories, software, maintenance, and support, to waive the applicable competitive bidding requirements of City Code Chapter 329, and to authorize the expenditure of $1 to establish the contract from the general fund. As you know, Mayor Ginther's promise was body cameras by the end of 2016 and phase in over a few years all of our police officers, or most of our police officers, with body-worn cameras. This ordinance authorizes the initial contract to enter into with WatchGuard, Inc. The reason for the waiver is we used an RFP process as opposed to a typical bid process for those cameras. And the reason why we did that is to allow the city the opportunity to see different technology, different options, able to pilot those cameras. On May 24th, when we published the request for proposals, there were 12 responses were received. Of those 12 responses, 5 vendors were considered for further evaluation and scoring. There was a committee of 7 independent scorers to these responses. The committee consisted of the mayor's office, the Division of Police, Department of Public Safety, the Fraternal Order of Police, City Attorney's Office, and the Department of Technology. From June through September, the city evaluated the proposals and conducted a pilot program which included approximately 30 police officers. On September 2nd, 2016, the committee selected 2 vendors as finalists for final pricing. A report was dated September 30th, was forwarded to my department for review and recommendation. It should be noted that there are advantages to both options, or all options that we looked at, and furthermore, the 2 finalists scored very well in their evaluation criteria. Our recommendation is based on not only the scoring, but other factors that we looked at, and that the feedback that we got from the police officers and from the committee. I shared my recommendation with Director Pettis and Chief Jacobs. Both have agreed and both support the recommendation to go with WatchGuard in regards to this. There will be a subsequent ordinance, I believe it's December 5th agenda, which will be in the Safety Committee, which will fund for those cameras off of this contract. And again, we're on track to outfit some of our police officers by the end of this year.
And Director, what are some of the next steps in getting these devices into service? So for an example, the storage, et cetera. So what needs to happen as we keep moving this project forward?
Thank you, President Pro Tem Tyson. The next steps would be, we would then have to connect the cameras to servers here with the City of Columbus in our Division of Technology. The deployment of those cameras will be up to the public safety of how they want to deploy those cameras. But the next steps would be the deployment of those cameras, ensuring that we have storage, which we do. And then as we go down the road during the different phases, is to continue to just purchase from this contract the cameras that we would need for a particular phase, which is why we did the UTC as opposed to a one-time purchase. This allows us to buy the cameras as we need them, to keep up with any new technology changes that might happen with those cameras, and to allow the police department to fully implement at their pace as we go through this process in the next few years.
This legislation will be on for December the 5th. That's the plan.
That's the plan,
From
yes.
finance, for the Finance Committee and the Safety Committee.
That is correct.
Working together to be able to outfit our
Yes.
police officers.
Yes.
With body cameras.
And then the servers will be a competitive bid as well.
All right. Thank you, Director.
You're welcome. The next ordinance is Ordinance 3086, 2016, and this ordinance is to amend the 2016 capital improvement budget to authorize the city auditor to transfer funds within the Construction Management Capital Improvement Fund, to authorize the Finance and Management Director to modify a contract with Palmetto Construction Services, LLC, for Phase 1 renovations at 4252 Groves Road building, and to authorize the expenditure of $1,650,000 from the Construction Management Capital Improvement Fund. During Phase 1 of the renovations at 42, I always get the address wrong, 4252 Groves Road, includes renovations in the exterior and the interior of the building. That building eventually will have the Support Services Division of the Department of Safety, along with Weights and Measures Licensing Division. During the initial construction of the exterior, during the renovations of the exterior, we ran into some groundwater. That was unforeseen. It was not, we did not know there would be groundwater in the area. As we began to fix that, it kept coming, and we got more water, and we got more water. So this modification is to allow the construction company to now build a retention pond as part of the project. So this modification is to add the $1.6 million for the unforeseen underground water issue that we had at that location.
I need to ask you just a question. So when we did the initial contract of the $12 million, did we put in like a 10% contingency fee in this or not?
Yes, there is a contingency fee, and as we were trying to fix that problem, we were getting into that contingency. What we found out is that water was not stopping. We thought it was an ability for us to stop it, and it just keeps coming. And I don't know, but I know they gave me the number of gallons each day that the water was coming. It was a lot of gallons of water. So this is to help us not only fix it, but to keep moving that project so we don't have to delay it anymore. So this is mostly for the fix of that problem.
Thank you. And you're saying that this will not delay,
This should not delay that project because we continue to work inside it. Certainly we'll have to reallocate some resources of the construction company to begin to fix that problem, but they're still continuing to work on the exterior. It's just in that area that they're going to have the issue. So we should be able to continue working at other parts of that building.
Thank you. And then this is Phase 1, and so when do you anticipate Phase 2?
I don't know that answer this evening, but I can get back to you on that.
All right. Thank you, Director.
The next ordinance is 3119-2016, and this to authorize the Director of the Department of Finance and Management on behalf of the Department of Public Utilities to execute a release and satisfaction agreement with Thomas Kessler and Danita Kessler and any abutting property owners in order to limit erosion and flooding in the vicinity of 5030 Woodhaven Drive, Galena, Ohio. So this property is located on the Hoover Reservoir. The city is permitting a release and satisfaction agreement to the Kessler family, which would permit them to remove soils from their property and to provide installation of erosion control measures adjacent to some of our property. The Department of Finance and Management, Recreation and Parks, and the Department of Public Utilities have determined that granting this temporary construction right to allow the removal of these soils on the city-owned property would not adversely affect the city and should be allowed in exchange for the Kesslers and their abutting property owners to execute the release satisfaction agreement. This will also release the city from any future liability associated, including but not limited to any erosion or flooding. So it's a good thing they are going to put up erosion control around the Hoover Reservoir, which is important to our waterways.
You're absolutely right, so thank you.
You're welcome. The next ordinance is 3137-2016. This is to amend the 2016 capital improvement budget to authorize the city auditor to transfer funds within the Health GO Bond Fund and to authorize the Finance and Management Director to modify an existing contract on behalf of Facilities Management Division with Continental Office Furniture to authorize the expenditure of $25,000 from the Health GO Bond Fund and to authorize the expenditure of $25,000 from the Construction Management Capital Improvement Fund. So the total funding is $50,000, and this is to, there are flooring needs at the Health Department, And there's various rooms, including the auditorium at the health department, that are in need of new flooring. So we have a contract with Continental Office Furniture that does our flooring for us. And this is just to add money to that contract so that we can put new floors in over at the health department.
Thank you.
Next ordinance is 3140, 2016, and this is to authorize the Finance and Management Director to modify and extend the contract with DeLille Oxygen for the purchase of lab, industrial, and specialty gases, and there is no dollar amount. We're just extending this contract for 6 months. A new bid went out. All the bids that came back were non-responsive for one way or the other. So we are going to rebid that contract and review the specifications to see if possibly it was a specification issue. So to allow for that to happen, we needed to extend the current contract for an additional 6 months to allow us enough time to rebid it for these specialty gases that are used at various city agencies.
So we're just modifying the existing contract, and so there are not any additional, although there will be additional dollars for
Yeah,
the
the-
6 months, but it'll be the same as what's in the current contract.
That is correct. The same terms and conditions and pricing. There will be no change in that.
All right, thank you.
You're welcome. Our final ordinance this evening is 3147, 2016, and to authorize the Finance and Management Department to modify and extend the contract with Grant Riverside Methodist Hospital's Work Health for the purchase of drug and alcohol testing services. Just like the previous contract, there's an RFP that's being developed. These are important services for our I believe this is for our new employees to get alcohol and drug testing. During the process, as we begin to put that specification together, we needed to extend the current contract at the current pricing, the current terms and conditions for at least 6 months to allow that RFP to be bid out and evaluated and awarded.
So this is for pre-employment candidates and various other tests such as random testing for city employees.
That is correct.
Okay, thank you.
And that's all we have this evening.
Thank you, Director. And I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as finance-related legislation that is necessary to support the ongoing city operations. As residents, these hearings are an opportunity for you to learn and become engaged in issues that are presented. Before we conclude tonight's hearing, I would like to thank, from Columbus Public Health, Nancy Bechtel, the Assistant Health Commissioner and Chief Nursing Officer. Also from Columbus Public Health, Kelly Arthur Hikes, Director of Public Health Policy. From the Department of Finance and Management, Joe Lombardi, the Director. Columbus Downtown Development, Matt Lutz, who's the Chief Development, I think he's the CEO, he's the legal counsel he was legal counsel for the downtown development. And also want to always thank my fellow council members and their staffs who serve our community with pride each and every day. I want to also thank the City Council's Legislative Research Office, especially Michael Kessler, who leads the Legislative Research Office, Andrew Dwyer, who staffs Health and Human Services and Workforce Development Committees, Matt Erickson, who staffs the Health Committee, Aaron Beck from the Legislative Research Affairs Office, Nancy Sully from City Council's Community Engagement Division, and then, of course, my staff, Nicole Harper and Carl Williams, who work very hard to make sure that everything goes well for me as I'm on the floor and doing my job. Just really appreciate them. And then the hardworking team at CTV who make these hearings possible. And finally, the residents of Columbus who make our city the best place in the country to live, work, and to raise a family. And this hearing is adjourned. Thank you.